My North Star has always been that healthcare is a human right. Anybody that wants to seek healthcare should be able to. They deserve to. Anybody can go to the emergency department when they get sick. The trick, though, is when you're not sick, in order to stay healthy, where do you take you and your family to in order to be able to engage in healthcare? That's what primary care is. Some people need to have their social needs addressed. Some people are worried where they're going to sleep that night. Some people are worried about their diabetes. There's no wrong answer, and there should be no wrong door to receiving healthcare. First and foremost, I'm a primary care doctor. I've been a primary care doctor in my clinic in the Bronx for over 8 years now. I've also been in charge of primary care for our system, and now as our new Chief Medical Officer for Clinical Services and Population Health, I have a chance to help our inpatient units in the hospitals, think about population health more broadly, and think about how I can help the city with new initiatives as well. One thing we've always been proud of at New York City Health and Hospitals is anybody that's called us to get a primary care appointment, the answer is always yes. The challenge is the answer has oftentimes been yes, but there's a several-month wait. Then after NYC Care, the conversation was different. It was sure, we'd love to see you, same start, but the difference is within 2 weeks. We offered everybody an appointment within 2 weeks, and that made people feel different. It felt like they were going from having a barrier in front of them to having that barrier completely removed and being able to really feel like they deserve medical care. Your A1C for your diabetes. Perfect. You're doing a great job.
Su A1C de la diabetes está perfecto, muy bien, está haciendo un muy buen trabajo.
Gracias, doctor.
¿Tiene preguntas? When we first went live with NYC Care, my first NYC Care patient hadn't seen a doctor in 43 years. She had missed all of her cancer prevention, didn't know if she had diabetes, had no vaccine. We fixed it all that day. And at the end, I couldn't resist asking her, what's different today? You could have come yesterday. You could have come last year, the year before that. And she looked at me and she started crying. And she said that before NYC Care, she didn't feel like she deserved healthcare. Because she didn't feel she deserved healthcare, she literally had missed so much life-saving care. But the difference that I made for her that day through the program was not just her that one day. It was an example that we've then done 150,000 times after her. 8 years after I came here, we have more primary care patients in our system today than in the recorded history of our system ever before. That, to me, as a primary care doctor, is the most important way that we could start to change the world. We are the type of city that will move heaven and earth to help every New Yorker without exception. Whether that's having the most robust response to COVID in the country, where literally in every street corner we had a mobile unit when the city was facing its asylum seeker crisis. We didn't shy away, we leaned in. We had an arrival center first in the country. I think the favorite part of my job for me is seeing with my own eyes the impact the policies we've made, the decisions we've made, or the programs we've started have had. And that's why I'm proud to be a New Yorker.